it going into a presenter mode. So
we can see the slides.
yeah, so as long as everybody can sort of see the slides, I'll just try and make the window a little bit bigger so that it's not
in progress.
Distracting. Okay, so sorry, there we go. Okay, so as Nicole mentioned, my name is Dr. DiSano. I'm one of the pediatric epileptologists at Akron Children's Hospital. So it's wonderful to get to speak to you today. I was asked to speak about seizure detection devices, and I actually learned quite a bit myself about this topic. So hopefully you all take something away from it as well. Just a little bit of background from me. So I am not from the Cleveland or Northeast Ohio area originally. I grew up in Rhode Island. I went to undergraduate school in sort of upstate New York, and then went to medical school in Houston, Texas. But then came back to the Cleveland area for training. I did my residency and fellowship in epilepsy at the Cleveland Clinic. And I've been at Akron Children's since the fall of 2019. So that's just a little bit about myself and sort of my background. And as she mentioned, so I did my training in pediatric neurology, my specialty working at Akron Children's is in pediatric epilepsy. But I do, have some experience with adults and adult epilepsy as well. And certainly there's quite a bit of overlap. So just so that way you guys have a little bit of information about me. So to get into the talk today, so I don't have any disclosures. However, there are some things that I do want to make sure that we discuss regarding today's talk and topic. I don't have any financial relation. We are going to discuss a number of devices today made by a variety of different companies. I personally do not have any financial relationship with any of the manufacturers of these devices that we will discuss today. Also, that's sort of important, and Akron Children's, as far as I know, does not have any sort of relationship with these manufacturers as well. We are going to talk about a number of devices today. Not all of the devices, to my knowledge, are available in the US. Some are approved by the FDA for seizure detection. Others are not. And so in that situation, we will be discussing kind of off-label uses for some of these devices as well, though. So I just wanted to make sure that everybody is aware of that. So what I think we need to start somewhere. So, a place that I like to start is try to define the problem. So what is a seizure detection device and what should they do? And I put should in parentheses because, these devices may do this to some degree or do some of these aspects, but not all of them. But I think at its core, a seizure detection device and patients want from a seizure detection device something that can detect a seizure. And so that's, I think we can all, that's sort of a hard stop. That's why I put that in red. A device, a seizure detection device should be a device that can detect a seizure. I think that's sort of self-explanatory, but as we're going to go through some of these devices and kind of their uses, not always something that we get from these devices, unfortunately. I think sort of as a secondary aspect, what it should do is probably a seizure detection device, when it does detect a seizure, should probably be able to alert some sort of third party, whether that's a caregiver, a loved one, or even EMS, that a seizure has occurred. And that should be particularly in place to be done automatically if a patient is not able to do that for themselves. And we will certainly talk about some devices that have that capability. And then lastly, this is sort of maybe a device should do this, but maybe not, is the potential for recording and storing of seizure information, essentially for tracking seizures, for review of seizures later, either by yourself, as population in a seizure diary, or even for, review of a provider, your neurology provider at your follow-up visit. So I think it's important to maybe now talk what seizure devices don't do. Seizure devices do not prevent, diagnose, or treat seizures or epilepsy. Maybe with an asterisk for diagnosis, because we will talk about, and certainly some seizure devices can help or assist or aid in the diagnosis of seizures or epilepsy, especially if the diagnosis is not clear, or there may be other neurologic issues that may represent, and having a detection or having a video of that event may aid or assist in the diagnosis. They do not detect all types of seizures. And then I think that is something that is definitely going to become evident as we start going through a lot of these devices. Seizure detection devices do not prevent seizures or epilepsy-related morbidity or mortality, including SUDEP, which for those of you here who have never heard of SUDEP, so SUDEP stands for sudden unexpected death in epilepsy patients. This is obviously something that is very serious. It's thankfully a relatively rare cause of morbidity or mortality for patients who struggle with epilepsy, but certainly something that is out there. It is a risk. And while, we hope and expect these devices to maybe help at least make us aware of seizures, unfortunately, at this stage, they don't and have not been shown to at least reduce morbidity or mortality yet. Now, maybe in the future, and I think that's one of my hopeful things, certainly. They do not detect blood or changes in blood oxygen or heart rate. That is most devices. These devices typically, at least the ones that are on the market now, detect motor seizures predominantly. But there are some caveats to that, and we'll talk about some of that information as well. So I think when you're picking a device, and this information is this is different for everybody, but there's some maybe caveats and things that you need to keep in mind if you're thinking about obtaining a seizure detection device, to keep in mind as you're picking them, to make sure that you're picking the right device for yourself or for your loved one. And so some of this information I adapted from the epilepsy.com and Epilepsy Foundation website, as well as the Danny Did organization. So I think the first thing that you have to keep in mind is the type of seizure and the timings of the seizure. So does the person have tonic-clonic seizures? Or does the person have other types of seizures? As I already mentioned, a lot of these devices are movement-based devices, and they may not detect seizures that are not, tonic-clonic or movement-based types of seizures. And so, making sure that you have the right device for your type of seizure is important. When do your seizures typically occur? Or when are you hoping to track seizures? Do you have daytime predominantly seizures or nocturnal seizures? Or if you have them any time of day, or if they can happen any time of day, are you predominantly worried about the nocturnal seizures? In which case, then maybe a mattress device or a sleep aid device may be sufficient. Or are you hoping to be notified of any seizure of any time of day? In which case, then maybe it needs to be a wearable device that can be with the patient for throughout the day. Are you looking to track seizures to know how often seizures are occurring? Because not all devices do this or have this capability. So making sure that if that is something that you're looking to do, or your provider is hoping that the device will do for you, making sure that you pick one that can do that. Are you looking to record or learn what your seizures look like to assist and aid in a diagnosis? So, is it a device that just goes off when it thinks that there's a seizure detected? Or is it something that will actually videotape or record an audio or video component to the seizure, so that you can bring that back to your provider and show them, hey, this is what my seizures look like? Lastly, are you looking for the device to alert, like I said, or a safety check to let somebody know that you had a seizure or your loved one had a seizure? And I think this is particularly important if you live alone, or with someone else, and how would they be able to check on you? And I think, this is easier for me and my patient population that I take care of, because the vast majority of my patients are minors or children who have parents, guardians, loved ones, obviously very nearby, sometimes in the same room or in the same household. And so, but this is different certainly for adults who live on their own, have jobs, drive cars, who may not have somebody in the next room to be able to check on them right away. So some common device concerns that I have come across and have seen. The first is really with data and privacy. We are essentially talking about medical health data and insurance information. And so, these things are protected. And so some of these devices, they need to have safeguards in place to protect your medical information as protected under HIPAA. Another aspect is, sort of a double-edged sword. Does the device have location tracking data? Would be important if somebody is out and has a seizure, you need to know where they are so that you can get them help. But at the same time, these devices are collecting your location and maybe transmitting that. And so some people may have pause about having that capability. Another significant issue is cost. Many of these devices range dramatically in how much that they can cost. There's often an initial upfront cost. There can be often recurring service fees that go with them that can be very costly over time. A lot of these devices are not covered by insurances, and so it is full and out-of-pocket expense. There is no insurance reimbursement. There are some organizations that can assist in helping patients, particularly high risk, obtain these and maybe help pay for them. But that is certainly an issue and can be a challenge for some patients. And then, is there a trial period? Do you get to try the device for 2 weeks or a month to see if you're going to like the device, to see if it's going to work for you before you invest sometimes hundreds or even thousands of dollars in the device to assist? And then lastly, false positives and false negatives, which is a very common issue with the current sort of device landscape, shall we say. And we'll talk a little bit more about that and some research actually that's gone into that. So there are several types of devices, and we're going to kind of go through different options, some options of all of these types, but they essentially at this stage fall into one of 5 main categories. There are mobile apps for smartphones. There are watches or other wearable type devices. There are video and camera or motion detection type devices.
These things for epilepsy that you can do.
I'm sorry, is there anybody there? Hold on, let me see here. Okay. Sorry. So video and camera motion detection devices that use a variety of sensors. There are mattress monitors. And then we'll talk a little bit about detection animals as well. Devices such as the implantable devices, such as a vagal nerve stimulator, VNS, or a responsive neural stimulator, RNS, as well as home or ambulatory EEG or electroencephalogram, are really beyond the scope of this talk. So I actually won't be discussing those devices. I wanted to primarily focus on kind of wearable, end user, non-invasive type seizure detection devices today. Oops. There we go. So here listed are a few types of detection and potential limitations. So I have in the top corner here the EEG. And the EEG, if you're familiar with seizures or epilepsy, you're familiar with the EEG. The EEG is a process where they put a series of buttons on the head and look at the brain's electrical activity. And this, from a seizure detection standpoint, really is the gold standard. The problem with this is that it's not always practical. There's a high technical component. It's time consuming. EEGs are typically short. only for a few minutes, sometimes maybe an hour or two in the office setting. There are overnight EEGs that you can wear home, take home, or do again in the hospital setting, but these things are very time consuming and expensive. And it's just not practical if, for instance, somebody has rare seizures that are once a month. It's not practical to have somebody sit in a hospital bed waiting for their monthly seizure. There are cardiac or electrocardiogram devices that essentially look at changes in heart rate that can come as a result of some seizure activity. And so these are devices that can monitor your heart rhythm, heart rate, or variability in your heart rate. And it's sort of a proxy measurement for detecting seizures. But certainly, you know, patients can have normal variability to their heart rate that is not seizure related. When you exercise or work out, your heart rate goes up. When you get scared or worried, your heart rate can suddenly go up. When we sleep, our heart rate often will decrease. So these things, these measurements, it is a proxy, and it is not always the most reliable measurement. There's accelerometry. Sorry, I have trouble with that word. And so this is really usually a wearable device that measures changes in movement. But again, can fall victim to, you know, daily activity, repetitive movements. I've had patients that have worn these like watch type devices, and the device triggered for their parent to come running outside, and the child was playing basketball and dribbling a basketball, and it set the device off that he was having a seizure. There's surface electromyography, which is essentially a sensor that measures muscle activity, usually under the skin, the muscle electrical activity or detection. This is a very interesting area, and probably one that's one that we're going to see a lot more newer devices that probably utilize this technique in the future. And there's even evidence to suggest that these types of devices could actually differentiate between true epileptic seizures and non-epileptic or psychogenic non-epileptic events or spells, particularly for patients that have both. There's devices that look at electrodermal activity, so actually measuring skin resistance and conductance through sweating and other changes that can occur during certain types of seizures. And these are particularly helpful or exciting as well, potentially for patients that have non-motor seizures. There's the video method, which I mentioned, can capture multiple types of seizures, but unfortunately, again, can fall victim to things like reliability, cost, and privacy issues. There's the mattress devices, which again, as I mentioned, are really only going to be useful if you're in bed and on your mattress. And again, are usually motion or pressure-based devices, similar to some of the ones that we've already talked about. Then there are a whole list of other things that are on horizon as well. There's things called near-infrared spectroscopy, which is basically uses light and a sensor on the scalp or head to look at blood flow in and around the brain. Unfortunately, that has not, it's helpful for other circumstances and situations, particularly in a hospital setting, but unfortunately, so far, these devices have not panned out as being very reliable for seizure activity. There's respiratory devices that monitor changes in respiratory patterns, audio-based devices, blood pressure monitors, oxygen saturation monitors, and others. And then there are these multimodal devices that actually use multiple different sensors to get at several of these things together, and then use some sort of algorithm to essentially create a reliability to say, okay, I have this sensor, and therefore they must be having a seizure. So to go into a couple of devices, we'll start with some of the mobile apps. So one that I had never heard about before I'm preparing for this talk is the Nile app. It is essentially a digital care management app that's available for your smartphone. What's nice about this app is that you can actually, if your provider is registered with the app and with the app company, you can use this app to directly connect with your care team. You can use it to track symptoms. You can put your medications into it, set reminders to take your medications, and support a treatment plan. It has a very nice, very modern, sleek-looking patient dashboard for provider access as well. Not that this is necessary in this, particularly in COVID times. I think a lot of these apps and companies have created provider portals to connect patients to their doctors more easily, particularly when we weren't seeing patients face to face nearly as much. They did not want to have our epilepsy patients, seizures didn't stop because of COVID. And so they didn't want patients to feel isolated. But obviously, with MyChart and Epic Access and pretty much every electronic medical record allows patients to connect to their providers, but this was another method. And a lot of these apps and companies have done that. There's even a titration manager for medications for providers. So I could actually put into your app when and how I want you to increase or decrease your medication. And then this is actually the preferred diary app for the Epilepsy Foundation, which actually, according to the app website, it supersedes the previous application that was developed by the Epilepsy Foundation called My Seizure Diary, if any of you have experience with using that. This is kind of the new version of that, more or less. Another app is something called Capture Proof. This is another mobile app for your phone, but that actually allows visual health record, allowing patients and providers to securely share photos or videos with their provider and patients back and forth. It has a function of being able to be used essentially as a visual seizure diary in order to use it to capture video of your seizures. Now, obviously, this isn't an automated thing. Somebody needs to operate the app for you if you are having a generalized seizure. But this app is also not specific for epilepsy or seizure management anymore. It actually can act as a virtual asynchronous care delivery system for a variety of different specialties, neurology included. So you actually upload pictures or video of your neurologic exam, depending on what your complaint is, or a picture of a rash that you have to your dermatologist. And somebody through their group, they contract with providers to actually give you, care, essentially. I think this, again, is something that has come up. This app has changed since COVID. But another option as well, and it has this option for a video voicemail. So basically, you can create a video, audio, and send it to your provider. Then there's sort of the most basic, which is the Seizure Tracker app. It's a website as well as a mobile app for your phone. And you basically create a personalized report of your seizure activity and your anti-epileptic medications. This says only user input. I meant input data. So basically, you have to provide the app with all of the information. There is no automated scheduling or any of that is part of this website. Essentially, but it is free. Like I said, it comes as a website, a mobile app for Android and Apple and Android, as well as there's even an Amazon Alexa skill that you can tell Amazon Alexa to do certain things and upload them to your seizure tracker. And that it can also record and share video with attached links from YouTube, which is also very handy and helpful as well. I can tell you that that's what I have done with a lot of my patients, uploading videos to YouTube and then sharing them with me, because our electronic medical record at Akron Children's does not have the ability to upload video directly. And so when COVID and patients were not meeting face-to-face with me or their providers nearly as much, this was something that we implemented with I would say, considerable success. I still have a number of patients that is how they share videos with me of their seizures, or parents that have captured something for their child that they're not sure is a seizure and want me to review it. That's how they can get it to me. And this app can actually act as the go-between for that as well. So another option. And there are others out there. This is, this list is by no means exhaustive or all be all end all. I just wanted to highlight some of the ones that are more popular and out there. So in the watches and wearables, there are a number of pulse oximeters. Again, as I mentioned, these are devices that measure your blood oxygenation. They're usually a device that's worn on the finger or toe. They monitor your heart rate as well as blood oxygenation. But obviously, this is not specific for seizure. Some of them do have alarm functioning built in. And some of the examples in the top corner here is a pulse ox device like you would see in a hospital setting. Below that, this is actually a commercially available device that I have run into and a number of my patients actually have. Again, not specific for seizure, but the Owlet device is a It started as a wearable device for babies, for infants on the feet, so that parents could monitor their blood oxygenation. The idea was it would reduce rates of sudden infant death syndrome, or SIDS, which in a lot of ways shares a lot of similarities to SUDEP, unfortunately. And so this was a device marketed to parents as a way of preventing that, or at least monitoring for that. And nowadays it's even gotten very advanced, as you can see in the lower picture here, that includes cameras and other smart, a smartphone app and other things. But as you can see, these devices are extremely costly, and you can see the size of the device. It's meant to be worn on the feet of an infant, not for adults. Another popular app that's out there now is called Seize Alarm. This is an iPhone and Apple Watch application. It detects seizure-like movements using the different sensors in your Apple Watch, like the accelerometer, and it can also detect some changes in heart rate. You can set up emergency contacts to alert in the event that the app detects a seizure. It can even, this was actually kind of an interesting thing, it has help buttons. So for patients that have focal seizures with retained awareness, that sometimes can turn into a secondary generalized seizure, if you're aware of that, you can actually select the help button and call for help yourself. And it even has a delay, so that if you have auras that don't always, you can hit that, and then in say 3 minutes, it will send the alarm. And if it doesn't turn into a generalized seizure and the aura ends, you can actually turn that off yourself and not alert anybody. It has an iPhone only app, but obviously you're going to lose out on the motion detection component of that, because you're relying on the Apple Watch for that. It does have GPS device location, but again, the device is fairly costly, or the application is. It has a recurring monthly fee of $15 or $150 per year. Another app is called the Inspire app. This is for Samsung watches as well as the Apple Watch. Again, it kind of works in the same way. So it has other names called the Smart Monitor or Smartwatch. These are its older names. Again, same idea, detecting movement, alerting family members. Again, you can summon for help from the app. You can set up medication reminders. It records audio as well as heart rate during the episodes. And again, there's a cost to the watch. You have to purchase the smartwatch, as well as the application fee is $20, and there is a recurring subscription fee as well. Then this is probably one of the more popular devices that's out there. I know in my patients, this is probably the most frequent one that I come across. It's called the Embrace Watch by Empatica. This is actually FDA approved, was approved in 2018 as an alert device for seizures. It mainly detects, again, movement activity through a variety of different sensors built into the watch. So it's going to predominantly detect tonic-clonic activity and tracks physical activity and rest. It does need a smartphone to be paired with that's Bluetooth capable. Again, it can designate alerts and family members, and it can alert them through a variety of different ways, like text or calling. Again, there is a one-time subscription or one-time purchase fee. I believe it's $200 to $300, $250, something like that. And then again, there's a monthly recurrent subscription fee, but you can get a 30-day free trial to see if it's something that you would like to try. This device also does require a subscription or a prescription from your provider. And it does have companion apps with them. Again, there's the Alert app and the Mate app, which again is more of like a lifestyle tracker app and medication management monitoring. There's another device called the EpiAlert, Seizure Alert device. This is a waterproof wearable device, again, detects seizures through a variety of different ways. It has a number of sensors in it. They call it biometry or biometric tracking, heartbeat, skin temperature, motion, and electrodermal activity. It's essentially marketed as a daily assistance device. And of course, their website, and along with a lot of these websites and manufacturers, will have a lot of buzzwords on their websites like machine learning or AI, artificial intelligence. And while I think that there is some true excellent promise, because detecting seizures is truly a great problem for machine learning, I don't know how much we're there yet. So I think I put this here because, again, it's something for the horizon, but I don't know if we're we're living in that futuristic world just yet. Again, has apps for Android and iOS, depending if you're an Apple user or not. Again, you can set up alerts and GPS. However, this device is not currently on the market yet, and if you go to their website, it is currently available for pre-order only. So again, just now about a few different video camera motion detection devices. So one popular one is called the SAMI device. I will say I have not run across this a lot. I do have, I think, a couple of patients that do have this device at home. This is predominantly a sleep activity monitoring device. It uses a series of sensors, predominantly an infrared video camera, to monitor for seizure activity. There's an iOS app for Apple devices. It can set up alarms for unusual activity and alarm or alert a caregiver to the unusual activity concerning for seizures. And it can actually also click on to live audio and visual, so almost acting like a live video baby monitor. However, this device is one of the more expensive ones that are out there. Just the camera itself is $400. If you buy the whole kit, that includes, mounting brackets and other, hardware that is required to operate the device, as you can see, it can get very expensive, up to $1,300. Another device is called the miku baby monitor. Again, this is sort of a repurposed baby monitor device that some people will use for seizure detection. It's predominantly a respiratory monitoring device, but uses, again, cameras and multiple other sensors with camera to monitor for breathing. And they market it saying they can even watch breathing under clothing in multiple positions or lighting circumstances. And again, it has real-time alerts, Android or iOS, for movements, breathing sounds, awake and asleep transitions. But again, can be relatively costly. It's $400. And again, I put the Owlet Dream Duo here because, again, sort of the same situation where you have a camera and a baby monitor situation with that device also. So Mattress, talking briefly about mattress monitors, one of the most common ones that you will see is called the MFit. It is a non-invasive movement detection device for movement and sleep. It is marketed in Europe as a seizure detection device. And there are multiple epilepsy partners for this device here in the US, including the Danny Did Foundation, the Epilepsy Foundation of Vermont, and even the Epilepsy Association off branch of the Western and Central Pennsylvania are all listed on their website as being partners here in the US. Again, the device is, it's a mattress-based device, so it's only going to be working at night for movement and sleep activity. It's not going to help you during the day. And again, there's a significant cost associated with this device. It's almost $600. And then I put this here, the MFit QS is basically another kind of lifestyle tracking app that goes with the MFit monitor that you can use to track a variety of health-related issues, including medications and other things. Another maybe less sexy device that's out there as well is called the MedPage. Again, kind of similar premise. It's a mattress-based device designed to monitor for irregular movements and sleep. But this one is here in the US and essentially can alert caregivers. And they say it works for babies through adults. And again, $300 currently out of stock when I went on their website just earlier this week. And then lastly, just a little bit about seizure detection animals. So most commonly you'll see is the seizure dog. So these are typically special services dogs that are specifically trained for assistance of patients with epilepsy. And they can do a variety of tasks. They can summon for help if there's an event of a seizure. There's activating, medical alert, recognition, removal of obstacles, that could potentially hurt the individual. They can even block the patient because sometimes patients will, if they have loss of awareness but not go into a full body convulsive seizure, they may walk or wander, and you don't want them wandering into traffic or other things, say, and the dogs can help do that, prevent that injury from happening. They can attempt to arouse the patient after a seizure, and they will sometimes also carry medical information or rescue medications with them as well. They can also assist sometimes with balance and behavioral support. it's interesting because when you read about this, though, they typically recommend a fairly high seizure frequency of up to 3 or 4 seizures per month to help assist and train the animal. Not to say that you can't get one of these animals if you have a monthly seizure or even less than that, but they're saying the feeling is that they don't always, it may not be the best detection. And some of the groups that you can research to get animals from is domestic pups and forepaws as well. So just a few minutes that I wanted to touch base. I know we have about 5 more minutes and then we wanted to break for questions. Just a little bit about some recent research topics and areas in this area. So one is that there's the automated seizure detection using wearable devices, a clinical practice guideline, which was published by a joint group by the ILAE, which is the International League Against Epilepsy, and the IFCN, which is I think it's the International Foundation for Clinical Neurophysiology. And this was published actually in 2021, so this is fairly recent. And it was a clinical practice guideline addressing this very topic. It used a working group, which is basically a group of experts in the field of epilepsy like myself, to kind of review the research, review publications that have come out, and kind of put a meaningful clinical guideline together. And so essentially what they say in this is that devices are accurate for the detection of generalized tonic-clonic seizures or focal to bilateral tonic-clonic seizures. So it's that secondary generalized tonic-clonic seizure. However, they did mention that it's uncertain if detection alarms really result in any meaningful outcome. As I mentioned earlier, there's no proven benefit in reducing morbidity or mortality, unfortunately, yet. My hope is that in the maybe next 5 years or 10 years, we will start to see publications that do show that. Nonetheless, they still recommended the use of the clinically validated devices, for automated detection, especially in unsupervised patients. So patients that are not being, always watched by a parent or loved one, where an alarm could result in rapid intervention. And they define that rapid intervention as 5 minutes. So having a loved one in a different state know that you had a seizure may not be, of the best benefit or use of your time or money, to be perfectly honest. And they did not recommend it at this time for seizures apart from motor types of seizures. Another 2 more interesting, or not more interesting, but other interesting publications that came out this past year. So it was this paper here. It's an automated seizure detection with non-invasive wearable devices, a systemic review and meta-analysis. So this was published in Epilepsy, which is basically a very popular epilepsy journal. And the senior author was Dr. Patrick Kwan, who is a kind of a figurehead in the field of epilepsy and has been for 20 or 30 years at this point. And their objective in this paper was to review the performance via meta-analysis. And so what a meta-analysis is you go into the literature, you find a bunch of publications that all seem to try and answer the same question, and you combine all of those publications together to get higher numbers in hopes that you can make generalized or at least more generalized thoughts about that information and data. And so they looked at non-invasive wearables for epileptic, and actually they also looked at psychogenic non-epileptic seizures as well. And they used, and what was great about this is that they only included studies that used video EEGs, our gold standard. So these were patients that were on video EEG as well as wearing the device, and how often did those things correlate. And then they allowed them to determine what's called a sensitivity number, as well as a false alarm rate for automated seizure detection. You don't need to get into the details here, but what I want to stress is that they included 23 studies of like thousands, which included almost 1,300 patients, and each patient was monitored on EEG for almost 53 hours. And what they found was that devices that are wrist or ankle worn, so again, accelerometer based, so like an iWatch or the MFit, or they also used the wearable, as I mentioned earlier, the wearable surface EMG devices, and they found that there's an excellent sensitivity. And so what sensitivity means is of seizures that were detected on the gold standard EEG, how many of those were also detected in the wearable device? And so in this case, the sensitivity of 90.91 or 91%. The one caveat that they had was that the false alarm rate that they calculated was 2.1 for every 24 hours, meaning that the device went off 2 times every day. That was incorrect or false. And that this was higher for the wrist-worn devices, 2.5, compared to the EMG devices, which was closer to 1. And so their conclusion was that these devices have a very high sensitivity for seizures, but they also have high false alarm rates, or essentially a false positive rate is what they're looking at. And so they said that parameters that are not motion detected need to be explored further, and focal seizures that are not tonic-clonic have low sensitivity and high false rates. And then lastly, I thought this was sort of an interesting offshoot paper that also came out in Epilepsy this year, called Parental Preferences for Seizure Detection Devices. As I mentioned, I'm a pediatric epileptologist, so this was particularly interesting to me. And the publishers of this paper did a choice experiment for parents of what is most important to you in picking a device for your loved one. And to try to quantify what strengths or weaknesses and what help patients, what information are patients using to determine what is most important and how they pick their device. This was used through an online questionnaire, and they were trying to balance things, and they determined that a balance or preference between sensitivity and the positive predictive value of the device. So you don't need to know the statistics, but I just wanted to put this down here. So, as I mentioned, this is sensitivity. So a true positive is that the actual outcome would be the gold standard. Okay, so seizure detected on an EEG, and how often that the device also detected it, that's a true positive. If the wrist device failed to detect it, but it was an EEG seizure, that would be a false negative. You take the true positives and you divide it by a true positive plus the false negatives, the ones that it missed, and that gets your sensitivity rate. A positive predictive value is how often the wrist device goes off, again, with an EEG seizure, plus the times that it went off, even though it was not a seizure. And that's your positive predictive value. So that goes across kind of the horizontal, where sensitivity is up and down. And so they realized that the most important thing was high sensitivity and sort of average positive predictive value, so about 50%. And that makes sense because in the end, when you're picking a device, yeah, it may go off a bunch of times and not be a seizure, fine. But really, in the end, you want a device that if there is a seizure, it's going to catch it. And that's what high sensitivity is by definition. And so, of course, parents are saying, well, yeah, it can go off, but I need it to make sure that it captures the seizure. And so that ended up being what would bear it out in the data. And they also actually looked at, interestingly enough, they actually looked at what aspects of or attributes of the device were of relative importance. And they found that actually interesting, what they described as introduction to use, which is this green bar, was the thing that was the highest determiner of which device they would use. And that could mean how they were introduced to the device. Did the provider talk about the device and specifically its strengths and weaknesses and how it works? Do they have experience with these devices previously? And that was the biggest relative importance. Next was personalization. So can you tailor the device for you? Interaction with the device. Alerting was actually one of the lower items. And then the actual interface was the lowest. So I will break here. That was sort of concludes my portion of the talk. I know I ran a couple of minutes over, but I just want to leave you folks with these 3 websites. I did draw some significant amount of information from them. The Epilepsy Foundation, first and foremost. They have a whole webpage and question and answer section called The Role of Seizure Alerts, and that website is there. Also, the Danny Did Foundation, if you're not familiar with that, it's a wonderful organization, and they do a lot of information about, they had a lot of information, tremendous amount on their website. So I did utilize them substantially for this talk. And I'd encourage you, if you're interested for more information, to go there. And then the Chelsea Hutchinson Foundation is another foundation website that you could check out that does a lot of information about seizure detection, and especially the animal detection. So here are the references that I used, and I'm happy to open it up to any questions that you all might have.